How can I get bigger? How can I get longer? Or how can I get more girth? 55% of them were unhappy with the way their penis.
Meet Dr. Rina Malik from California, USA, working in a male-dominated specialty. She's a top urologist and pelvic surgeon, specializes in both medical and surgical care of the genital and urinary tract. Dr. Malik was named Top Urology and Urogynecology Doctor in Baltimore Magazine for 2019 to 2022. That's one of the top doctors in the United States. Are you always concerned about size of your penis? Want to find out proven methods that works? Stay tuned until the end to find out how. In this video, we are going to reveal latest science-backed methods to naturally extend penile size based on solid evidence. Dr. Malik says, a survey of 50,000 heterosexual men found that 55% were dissatisfied with the appearance of their penis. However, when asked, 85% of their female partners expressed satisfaction with their partner's genital appearance. Let's find out what has contributed to these feelings. One main reason is pornography, which has changed what people think is normal. Research shows the average penis length is about 5.2 inches, 13.2 centimeters, which is typical. A penis shorter than 2.9 inches, 7.5 centimeters, is considered a micropenis, affecting less than 1% of people. It can be caused by birth defects, hormonal issues, surgeries, or cancer. Let's focus on men with normal penile length. Many men worried about their penis size are actually within the normal range. The real issue is small penis anxiety, a disorder where men feel distressed about not being as large as they'd like. This condition makes them obsess over their size, sometimes for over an hour a day, even though their penis isn't actually small.
Actually, some portion of these men can be so distraught that it can affect their activities of daily living, and some of them can end up in the hospital due to their overwhelming obsession or even have suicidal ideation. This is not a joke. This is serious. This can have real serious complications for people. And so I think it's important to talk about this because this is part of men's health.
There are two categories of treatment options for people who suffer from small penis anxiety or distress: the non-surgical and surgical treatments.
The other major issue with this problem is that if you Google, how am I going to make my penis longer, you'll be inundated with tons and tons of websites and information that may or may not be reputable. Not licensed providers to do things to them that can have dramatic consequences. So please don't do that. Look for a reputable urologist, psychologist to help you with these issues.
Let's move on to other treatments to enhance penile length. There are 3 non-surgical options: 1 penile extenders, 2 vacuum erection devices, 3rd penile injectables. Penile extenders are devices that involve placing the penis in a hole with metal rods on either side and a silicone ring at the end to secure the head. These devices apply gradual mechanical traction to the penis over a period of months, requiring dedicated use each day. The data shows that men who consistently used penile extenders saw some increase in length, typically around 2 centimeters. The length was measured using both flaccid and flaccid stretch lengths, with the latter being a reliable estimate of erect length in urology. However, to achieve this small gain, users must be highly committed, using the device for hours every day. Potential side effects include numbness, bruising, or lack of effectiveness, as not everyone experiences results. As for the other non-surgical options, vacuum erection devices do not increase penile length, so they are not recommended. Penile injections, which come in various forms, have been associated with devastating complications, some even decades after use. Therefore, I strongly advise against using penile injections, as the data does not support their safety or effectiveness, said Dr. Rina Malik.
Right now, the data is not strong enough to recommend any sort of injection in the penis, and as I mentioned, you can have devastating complications up to 40 years after getting a penile injection. So please do not inject anything into your penis.
Let's move on to surgical treatments. There are several methods discussed in medical literature. The most common is suspensory ligament incision. This procedure involves cutting the ligament that attaches the penis to the pubic bone, By releasing that ligament, you can gain some additional length. However, this procedure carries complications and risks. There are also other methods like using flaps, grafts, or rib cartilage to increase penile length, have shown poor results and low satisfaction rates. The studies on these surgeries are not strong enough to confidently recommend them, and most have reported numerous complications.
At this time, we cannot recommend a surgery to increase your penile length that is not without a multitude of complications. The only time that you should proceed with any surgery for penile lengthening would be in the context of a clinical trial.
What is a clinical trial? A clinical trial is conducted at an institution that follows ethical guidelines, overseen by an Institutional Review Board, IRB. The IRB ensures that the study is safe for human participants, monitors data, and reports any adverse events. This provides a clearer understanding of the surgery's effectiveness and risks, which can then be accurately documented and published for the medical community to evaluate. Only then can urologists determine the true outcomes of such surgeries, based on thorough data from studies involving a significant number of patients. The bottom line is, while penile traction therapy can provide a small amount of length, as shown in the research, there isn't much you can do to significantly change the length you're naturally given. Many other treatments are still being studied and are not recommended for routine use. The most important step is to address the underlying anxiety with the help of a psychologist before considering any treatments that could be irreversible and end up having something disfigured or functional problems, potentially making things worse than before. And remember, always take care of yourself because you're worth it.